Hello guys, welcome back to the channel. Today I came with a very sensitive and important topic that many of us are not conversant with, and that is the clinical relevance of coagulation test. But first of all, what's coagulation? Coagulation simply refers to blood clotting, which is a defense mechanism that your body takes to avoid bleeding, or will I say loss of blood. Now, what are the clinical relevance? Number one, patient with unexplained bleeding. I'm bleeding from my nose, I'm bleeding from my ears. I wasn't engaged in any accident whatsoever and I'm bleeding. The doctor is going to say, okay, go for this test. And the test will help diagnose what exactly is causing this bleeding. Number two, patients that are ready to undergo surgery. It's very important that the doctor should know your bleeding risk, if at all your bloody clots, if at all your blood clots at all, or to know if at all it clots excessively. Another clinical relevance is patients that are taking anticoagulants. These are patients that already know that yes, I have these bleeding disorders, and doctor has already put you on some treatment, which are the anticoagulants. So you have to still go check if at all you're taking too little or too much of this anticoagulant, because if you're taking too little, your blood won't be able to clot, and if you're taking too much, your blood is going to clot too much, which causes blockage in the veins and in the artery. So what are these coagulation tests? We have the aPTT and we have the PT. The aPTT is activated partial tropoplast time, and we have the bronchobrain time. The activated, that's the aPTT, measures the intrinsic pathway, and this intrinsic pathway is a pathway that is dependent on the factors that are within the blood vessel, and this intrinsic pathway is very efficient when it comes to the stopping of bleeding, but it's just that it is actually slower in action. The extrinsic pathway, the bronchobrain time measures the extrinsic and the common pathway, and this extrinsic pathway is dependent on the factors that are outside of the blood vessels to stop bleeding, and it is very inefficient, but it is very fast to stop the bleeding. Now let's dive into automation in full blood count. Please do not forget to subscribe, like and drop a comment on the video. Your subscription matters a lot to us. You should avoid clotted sample when it comes to full automation in full blood count. The blood is being mixed thoroughly. The heme analyzer used in this procedure is called the Eden machine. This is a 5-pack machine, that is to say it measures the 5 types of the white blood cells, which are the neutrophil, lymphocyte, monocytes, basophil and the eosinophil. The machine works on the principle called the electrical impedance, that is to say they move singly into the probe, and the machine has the diluent, it has the lyse, and it has the probe cleanser. Benefits of automation in full blood count. Number one is speed. You can actually work on about 60 to 100 samples per hour compared to when you're using the manual method. Number two, accuracy. There will be less unknown human error on counting or precision of the white blood cells and the red blood cell, unlike the manual method that there might be so much error. Number three is less workload. You'll be able to have the time to focus on the abnormal cases and not the routine counts that takes a lot of time. Thank you so much guys for watching. Don't forget to subscribe and like, and see you guys in the next one. Bye.